I will call the House Committee on Human Service, Finance, and Policy to order, and the Committee Legislative Assistant will note the roll. It looks like we have a quorum, so Representative Gordon will be moving the minutes from Wednesday, January 22nd. Are there any additions, corrections, or changes that need to be made to those minutes? Seeing none, all those in favor of approving the minutes signify by saying aye. Aye. Opposed, same sign. The minutes are approved. As we go through today, just a couple of reminders. First, no signs, no outbursts, no clapping, no standing or sitting in the walkways or aisles. And if accommodations are needed for today's hearing or any hearing in the future, please communicate that with the sergeant's staff. As we move forward into today, we're going to be hearing public testimony on the governor's budget recommendations. Just as context, last Thursday, January 16th, Governor Walz put out his budget proposal for the upcoming year that was based on the December forecast. We expect, as is required after the February forecast, there will be a revised rendition of the budget based on whatever the forecast provides there. And so we look forward to seeing those revisions, but it's good now to set the foundation for what the agenda is from the executive branch and how they will be approaching those things. Would advise anyone who wishes to review those. I believe there's 550 pages of recommendations for just the areas that we have jurisdiction over. So there's plenty of good reading there. Reading there. As a note as well, the Department of Human Services was given the opportunity to testify today on the governor's budget, but has declined our request. They did request that I mention that, so there they have that. We'll be going through a list of testifiers today for public testimony. Because of the number of people who are on the agenda, we do have about 10 minutes each for the public testifiers, which is a real change in format for the committees here. Hopefully for the people who are offering testimony today, that offers enough time to present the pieces that you need to present on and gives us time for questions along the way too. So without further ado, we'll go and start with Johnny Tveld. And I apologize, you'll have to correct the pronunciation as you come forward. Welcome to the committee. As you get settled in and you're ready, please introduce yourself to the committee and present your testimony.
Thank you. Good morning, Chair Schumacher and members of the committee. My name is Johnny Tvets, and I'm a policy manager for ARM, a trade association representing disability waiver residential service providers across Minnesota. Thank you for the opportunity to provide testimony to the governor's budget recommendations. I'm here on behalf of our members to express our deep concerns and disappointment regarding the proposed cuts to disability waiver services and the impact these proposals will have on people with disabilities and their staff. First, ARM strongly opposes the proposal to cap inflationary adjustments at 2%. This proposal will exacerbate an already dire workforce crisis. Direct support professionals, which are a majority women and people of color, are already underpaid, making an average of about $17 per hour. This adjustment will further erode their wages. We hear time and time again that I love this work, but I just can't afford to keep doing it. These caps threaten not just jobs, but the essential life-giving care they provide to Minnesotans with disabilities. Additionally, ARM has strong concerns with other proposed reductions to disability waiver services outlined in the budget proposal. These include limiting rate exceptions, a tool that providers utilize when supporting individuals with exceptional needs, capping billable days to 351 in a calendar year, and limiting individualized home supports with training to 8 hours a day. These proposals, along with the other proposals included in the budget, will cut $600 million over 4 years from disability waiver services, destabilizing and dismantling an already fragile service system. The administration suggests that these cuts will not reduce access to service, only costs. We believe this assertion is unrealistic. You cannot remove $600 million over 4 years from an already strained system without serious consequences. Low pay and rising costs will lead to greater turnover, uncompetitive job openings, diminished quality of care, and increased barriers for families already struggling to support their loved ones. The governor has spoken about protecting the progress Minnesota has made, yet this budget dismantles the very foundation of that progress. Minnesota is proud to be a leader in compassion and fairness. We strive to be the best place to raise a kid, which is something the governor often notes, but will it be the best place to raise a child with a disability? Maintaining the full inflationary adjustment and protecting disability waiver services from the bevy of other cuts is not an indication of a program on autopilot, but rather the bare minimum to ensure this workforce and the people they serve are not left behind. I urge you to prioritize this community and protect services that allow Minnesotans with disabilities to live meaningful lives. So I thank you for your time, and I welcome any questions.
All right. Thank you, Mr. Tevets, for your testimony. Are there any questions for Mr. Tevets? Okay, seeing none there. Just one question for you then. Would help us break down what this would mean if this budget were to go through as proposed. What would it look like for a family, say, 3 years from now? What would the impact of this, compared to what is current law, what would the impact of this kind of be on a real local basis?
If I could call up my colleague, Sarah Grafstrom, to help me answer that question.
Yeah. Welcome to the committee, Ms. Grafstrom. If you could please introduce yourself for the record and help me answer this question.
Yeah, thank you, Mr. Chair and committee members. For the record, Sarah Grafstrom, I'm the Senior Director of State and Federal Policy with ARM. So local impact, I think what we have seen over the years is that when we are not investing in waiver services, we see group homes close, we see staff turnover, and individuals not being able to access their community in ways they would like. So when an individual's home closes, that means the family is now looking at, well, what do I do to support my loved one? Do I bring them home with me? Do I find a different home that maybe isn't in my community, but it's the only home that's available? I mean, these are, I think, when you really break it down, we are talking about people's homes that they've lived in for many years. And if a provider does not have the resources to staff them or keep them open, that has profound impact not only on the people that are living in the home, but their families as well. So.
Okay, thank you for that. Any other questions for the testifiers? All right, Representative Gander.
Thanks, Mr. Chairman. Thank you for your testimony. I've worked with group home residents for a very long time and their staff, and I know they're not overpaid. I know that they are just subsisting as you've described, the staff of these group homes. And so to cut these programs further and compromise, as you say, and creating turnover and maybe some job openings and closures, this is a big deal. And I will tell you again, firsthand from in the trenches, these folks are just getting by. The staff also. They're not overpaid at this time. Thank you.
Thank you, Representative Gander. Any response for that? Ms.
Mr. Chair, I would also just point out, as we're looking at the way our rate system is set up right now, we do have these adjustments that happen every 2 years. So our next adjustment was scheduled to happen in 2026. Based on data from 2023 that was posted in 2024. So that's a lot of years, and it's why sometimes I have trouble remembering what year I'm actually in when I'm looking at all these different years. But providers have already begun looking at, or have looked at, okay, here's what the rates are supposed to be in 2026, and they have made wage adjustments based on what they are anticipating to come, because that's how you run a business. You look at what your budget's going to be in the future and you say, okay, based on what our rates are going to be in 11 months, this is how I can adjust our direct support professional wages now, because we need to. When you're paying $17 an hour and you're trying to staff a home, we have providers that have increased wages by over $1 in anticipation of the future rate adjustments. And so now coming in and saying, nope, we're gonna cap that or take that away is going to cause just a major challenge for providers to be able to say, how can I continue at these wage levels when I'm paying over $1 more than what I'm actually being reimbursed for per hour? So the staff aren't paid enough. They're not paid enough at the wage that we are able to increase it, but certainly not enough if we're capping what providers are going to be getting in the future. So,
Okay, any follow-up? Representative Murphy?
Thank you, Mr. Chair. That was she just answered my question, so I'm good. Thanks.
Okay.
Thank you.
Very good. With that, the committee thanks you for your testimony today and wishes you well for the legislative session. Next, we have Aaron Hubert and Kyle Burnt with Leading Age Minnesota and Care Providers to present from the Long-Term Care Imperative. Welcome to the committee. If you could please introduce yourself for the record and present your testimony.
Thank you, Mr. Chair. My name's Kyle Burnt. Today, I'm here with the Long-Term Care Imperative. Today, I'll focus on the nursing home cuts in the governor's budget, and then my colleague Aaron will complete the testimony talking about home and community-based services. The governor's budget leaves us with one question. Are seniors receiving services in nursing homes and their caregivers part of One Minnesota? Since 2020, more than 2,400 nursing home beds have been taken out of service statewide. This does not include the 16 nursing homes, predominantly in greater Minnesota, that have outright closed, impacting access to care in those local communities. Our nursing facility settings continue to have elevated vacancy rates for workforce positions. These workforce challenges are driving the closures and bed layaways. This budget that the governor proposed looks to put a 2% cap to future rate increases. It will limit health insurance costs in rate setting and phase out planned closure rate agreements and single bed incentives. A cut of $218 million over 4 years. The governor's budget does not recognize the full costs associated with the Nursing Home Workforce Standards Board. We estimate that the requirements for from the mandates from that board will cost $150 million, while nursing homes receive a cut in the budget. Stacking the cut with the underfunding of the minimum wage standard that they've adopted, it would appear that the true cost of this would be a cut of $350 million. As a reminder, since we are early in session, haven't had an opportunity in front of the committee yet this year, the forecasted increase reflects past payments, not future money. This is because the system has a 15 to 24-month lag in data to update reimbursement rates. The forecast reflects projected growth based on past expenditures. It is not an infusion of money to help give our hardworking workforce a raise. We are coming out of a pandemic that decimated our workforce, our reserves, and the spirit of many of our caregivers. It was not so long ago that the staffing shortages were so severe that the governor had to call on the National Guard to help staff our facilities. Yet this budget proposal uses nursing homes to balance the budget, which leaves us with the question, are seniors in nursing homes and their caregivers part of One Minnesota? Thank you.
Good morning, everyone. Mr. Chair, members of the committee. For the record, my name is Aaron Hubert, and I am also here on behalf of the Long-Term Care Imperative. In addition to the items that my colleague just discussed, I would draw your attention to a few other concerns in the governor's proposed budget. The DHS portion of the budget acknowledges that elderly waiver, which is the primary way that low-income seniors access services like assisted living, home care, or adult day, does not have any sort of inflation factor. And while that might be characterized as a plus from the administration's point of view, it does have very real consequences. It means that rates will not increase at all, even if costs go up for a variety of reasons, including the compensation of our workers, the provision of their health care benefits, or accommodating an increased acuity of needs of our residents over time. Switching gears a little bit, the excuse me, the MDH budget proposes a 54% increase in fees for our assisted living providers. We already have a growing affordability crisis in assisted living, particularly for middle-income Minnesotans, and this will not alleviate that problem. The budget also indicates some proposed changes to the use of provider-assessed fine and penalty funds. The narrative doesn't get into detail as to what that means, so we look forward to reviewing the legislative language more closely. We would have pretty serious concerns if those funds that, again, use provider-assessed fines and penalty money, which should be used for quality improvement or recommendations from the Home Care and Assisted Living Provider Advisory Council, to instead fund agency operations. I think we would view that as a bit of a conflict of interest, or a perceived conflict of interest, if you're using fines and penalties to fund operations. We at the Imperative believe that there is an urgent need and a vision and to create a plan that will ensure access to care for a growing population of older adults. And we do not see that vision in this budget proposal. Cutting services or hiking up fees is the opposite of what is helpful to seniors and their families. Given that the vast majority of budget savings acts across all of the agencies in the governor's proposed budget seems to fall on the backs of the elderly, people with disabilities, and low-income Minnesotans, we can only understand that it would be mean-spirited, and we don't quite understand where it's coming from. Mr. Chair, we know that we are coming back to this committee in the future, so we look forward to offering legislative solutions that do compensate our caregivers, preserve access to care, and build a resilient workforce. Thank you for the opportunity to testify.
All right, questions for the testifiers here? Representative Gilman.
Thank you, Chair Schumacher. So I've got just a couple comments and then just a question as well. But I keep thinking back about just, you know, this humongous surplus that we had in our state and just the investments that were made. And now I feel like things are just being, you know, pulled back in a dramatic fashion. And I don't understand, you know, I don't understand that. So that's just my comment and frustration. In the interim, I've visited a lot of long-term care facilities. And again, when you talk about morale and helping those most vulnerable, I think about just, you know, there's some stats that we have in 2030, 1 in 4 Minnesotans will be over the age of 65. I mean, that's pretty wild to think about. I mean, it's 2025, that's 5 years. And to see that this budget, that there's not been importance placed on that or any projections in the future for that, I hope, and I'm excited to have DHS and MDH come and have conversations so we can just get our heads wrapped around how that is not, in my opinion, a good plan for the future. But how many, with the budget proposal, here's my question. How many nursing homes or beds will be affected by the budget proposal do you anticipate? I mean, when you saw the numbers come out, that's my question there.
Ms. Hubert.
Mr. Chair, Representative Gilman, there are approximately 315 to 320 nursing homes across the state. That's a rough estimate, and I don't envision that any of them would have no impact as a result of the governor's budget. So you could safely assume that every nursing home and every nursing home bed would be impacted by this budget.
Representative Gilman.
Thank you, Chair. So just to follow up to that, and I know that we'll be hearing more testimony as well. But again, do you see the biggest impact with the elderly waiver piece being the biggest impact, or is there anything else that, you know, recommendation-wise that you'll be coming forth to us with?
Ms. Hubert.
Mr. Chair, Representative Gilman, yes. We do look forward to bringing forward legislative proposals that address both the rising need for services in elderly waiver and providing that necessary upfront prospective funding to cover those unfunded mandates passed by the Standards Board for nursing homes.
Great.
Representative Gilman.
Thank you so much.
Thank you. As we wait for other questions, the question that Representative Gilman had about the number of facilities that would be affected, does that include the ones that are currently or on the cusp of being put in receivership?
You know, Mr. Chair, I think we'd have to confirm, but I don't know that they have an exception to those rules. The Nursing Home Workforce Standards Board does have a exemption or waiver process for those who are at risk of receivership, but I believe at this time, none have been granted.
Okay, thank you. Any other questions for the testifiers? Representative Murphy.
Thank you, Mr. Chair. Thank you for your presentation. My question is kind of around staffing. You know, I know the nursing homes in my area, they're under very low margins. One of the big struggles they had, you know, when the beginning of COVID came is just staffing. Do you see them putting them back in the position where staffing is one of their biggest concerns? And then how does that ultimately affect the number of beds that we have?
Mr. Byrne.
I can take
Ms. Hubert.
Thank you, Mr. Chair, Representative. So if I don't get to your questions correctly, please let me know. There is a very direct relationship between funding for nursing homes and the staffing levels that they are able to provide. I do believe, and we will be able to share this with you in a future hearing, that our occupancy, so the number of beds that we have available and full in Minnesota nursing homes, is recovering back to levels that we saw prior to the pandemic, and that is a result of making some improvements in stabilizing our staffing sector. That having been said, when you have reductions like those that are proposed in the governor's budget, it does have a direct relationship to the ability of a nursing home to staff their beds. So in order to make their budgets work, they may have to take more beds out of service, therefore reducing access. So there's a direct relationship between funding and then the ability to staff a nursing home bed.
Representative Murphy.
Yeah, thank you. Thank you for that. That's what I heard in my district too, is that, you know, they just work really hard to get the workforce. And when they can't get the workforce, then they just have to give up wings of their nursing home. And so this whole thing starts to snowball. And so it's just really important that we make sure that under those really limited margins that they're under, and with all the costs going up and now we're looking at capping them, they have no options. And so I appreciate the presentation. Thank you.
Thank you, Representative Murphy. Any further questions for these testifiers? All right, seeing none, the committee thanks you for your testimony today and wishes you well in your further endeavors this session. Next, we have Tom Evanstead. And as he's making his way forward, just to point out to members that there is further testimony that was submitted in writing that is in your packets today too for review. Mr. Evanstead, welcome to the committee. Please state your name for the record and present your testimony.
Thank you very much, Mr. Chair. My name and members of the committee, it's nice to be here this morning. Thank you. My name is Thomas Evanstad, Evenstad, Minnesota's innocent man, and I'm here today to testify in staunch opposition to Governor Walz's budget recommendations. My specific objections include by agency, Attorney General's Office, Corrections, Human Services, LGBTQIA, Two-Spirit Plus, Minnesotans Council, Legislature, and Public Safety. I'm proposing that Keith Ellison's office should be defunded unless and until, one, Ellison ceases and desists from his frivolous lawsuits and his treasonous rhetoric, vowing to resist President Trump's America First doctrine that the voters of this nation elected him to enact. A.G. Ellison's resistance is not only futile, but his political use of the AG's office to push back against the America First doctrine, specifically mass deportations of criminal illegal aliens, needs to be fully investigated and, if appropriate, prosecuted to the fullest extent of the law. It was Ellison, after all, who said in the wake of the George Floyd that no one is above the law, right?
And Mr. Evanstead, if you could please tailor your comments today to the Human Services budget that we're taking testimony on today.
So it's not the AG's office, it's just the Human Services part of the budget?
We are focused on the human services portion of the budget today.
Okay, in terms of human services then, MSOP. MSOP is run by Human Services. Governor Walz's budget allocates a huge amount of money for MSOP. As a side note, I applied to Governor Walz for Commissioner of Human Services, or not Human Services, I'm sorry, Public Safety, which would oversee MSOP. And anyway, Walz taps Bob Jacobson. I talked to him last year up here at the Capitol. He had not heard of MSOP, and he worked for DHS. So regarding DHS, MSOP is approximately or very much right on about 85% white. It has hundreds of level 1 and level 2 low risk, moderate risk sex offenders that are in MSOP, while at the same time, there are at least an equal number, if not more, high risk, approximately 85% African American sex offenders that are out here all over our state in every one of all over our communities. So I would propose that, if not the entire DHS budget, be defunded or withheld unless or at least MSOP, if not all of DHS, at least the Minnesota Sex Offender Program should be defunded unless and until there was a swap of the, say, 300, let's say. The number's approximately 300 of the 725 or so. There's about 300 of them that are level 1 and level 2. Again, that's low risk and it's moderate risk. And yet at the same time, out here all across our state, in our communities, there are hundreds of the highest risk, the level 3 sex offenders. So in terms of being limited to DHS, my focus and my recommendation to this panel would be to very, very strongly consider what I'm saying. I think you're all aware of the constitutional issues, and Judge Frank said this, and the Supreme Court declined to say that after the Eighth Circuit said this. It is a big problem, and it is a problem that no one in this state has been willing to face squarely. Not one single person in the state, Mr. Chair, members of this committee, not Governor Walz, no one. So I'm suggesting that as much as MSOP, the shadow prisons are under the rug, and the sense of safety because you have the sex offenders in MSOP, you all definitely should be aware, and the public needs to be aware, that there are, finally, once again, one final time, not to be a broken record here, there are hundreds of the lowest risk sex offenders that have been deemed by the experts to be level 1, low risk, level 2, moderate risk. Then why are there hundreds and hundreds of the highest risk level 3 sex offenders out here in our communities, putting our women, mostly, there's also male victims, but I'm talking about women and children, and I'm talking about any victims, male, female, it doesn't matter. There is something wrong with the state that puts low risk and moderate risk sex offenders from rural Minnesota. Well, they have, if you follow Crime Watch on X, Twitter, almost every day you're going to see Mary Moriarty's office and John Choi's office recycling violent, repeat, dangerous, black, level 3 sex offenders and white sex offenders. But again, my point is MSOP is about 85% white. If you look at the overall statistics of who commits sex crimes across the nation, and also right here in Minnesota, I can tell you this much, it is not 85% white. There's something wrong, there's an imbalance here, and I respectfully ask the committee to consider my remarks around MSOP. And I thank you for your time today.
All right, thank you for your testimony, Mr. Evanstead. Are there any questions for the testifier? Seeing none, the committee thanks you for your testimony and wishes you well in
Thank you
your
very
endeavors.
much.
Next, for the committee this morning is Mr. Dan Andreessen with the Minnesota Council of Health Plans. Mr. Andreessen, welcome to the committee. If you could please state your name for the record, and when you're ready, present your testimony.
Thank you, Mr. Chair, members of the committee. My name is Dan Andreessen with the Minnesota Council of Health Plans. We are the trade association for Minnesota's nonprofit insurers. Our members include Blue Cross Blue Shield of Minnesota, Health Partners, Medica, Sanford Health Plan, and UCare. Thank you for the opportunity to testify today with our concerns and several proposals in the governor's DHS budget. I'll start with the caveat that some of these concerns may change once we actually see bill language. So first of all, our first concern is the proposal to double the HMO surcharge from 0.6% to 1.25%. Every session, we hear concerns about the cost of health insurance, and adding additional taxes to insurance increases the cost paid by enrollees and small businesses. This tax falls on the fully insured commercial market and the Medicare supplement market. Insurers in the fully insured market are already paying multiple other taxes. In addition to the HMO surcharge, plans pay a 1% premium tax that goes into the Healthcare Access Fund and a 3.5% premium assessment that helps fund MNsure. Combined with the provider tax and the MA hospital surcharge, taxes on this market could collectively exceed 9%. These taxes are significantly higher than what plans pay in the self-insured market, which are around 3.36%. The Minnesota Center for Fiscal Excellence performed a summary of healthcare taxes, and that report was provided to you here, and could be a resource to you here in the future, just how healthcare taxes are assessed here in the state and what they're used for. When the proposal to increase the HMO tax was publicly released, we heard comments that plans have plenty of money and can pay more in taxes, likely a reference to the larger for-profit insurers. However, in the fully insured market, around 94% of the lives covered are through a nonprofit insurer. Most of them are council members and historically have 1% to 3% margins. We should all be working to lower premiums and out-of-pocket costs, not increasing them through more taxes. Our second concern are the proposals to carve out the pharmacy and NEMT benefit from the state's managed care program. As you have heard in the committee last week, the state uses a managed care model to provide health care to a majority of Minnesotans enrolled in medical assistance. In this model, participating health insurers known as managed care organizations or MCOs are selected by DHS and counties through a competitive bidding process and sign a contract with the state to provide access to care using monthly capitated payments. The managed care model provides several significant benefits to the state, but most importantly, it improves health outcomes because of the care coordination performed by MCOs. Care coordination means serving the whole person. This means helping enrollees set up a needed appointment to go see a doctor, helping arrange transportation to and from that appointment, and if that patient receives prescriptions for a medication, the MCO can check in real time if that member was able to receive that medication and is receiving timely refills. If there's any issue along the way with any of these steps, the MCO care coordinators are there to help. Prescription drugs and NEMT services are important components of a healthcare, and carving these benefits out will remove the vital opportunities to coordinate that care. Because these services are currently within a single managed care plan, an enrollee has a single point of contact if any issues arise. By carving out the pharmacy and NEMT benefits, enrollees would have to contact 3 different entities depending on what type of service or questions they have. They'd have to contact DHS for their pharmacy benefits, another entity for any NEMT benefits, and then their MCO for any other services. We're also concerned about the likely increased overall cost of this approach, given the experience of pharmaceutical carve-outs in other states. West Virginia is often cited as an example of a state why you should do a carve-out, but if you dive into the details, you'll find that the cost per prescription is increased, and several studies show that keeping a pharmacy benefit within a managed care model is more cost-effective than carving it out. All that being said, I think the most important question when we're looking at these carve-outs is, how are the lives of the 100 million, or the 1 million Minnesotans who are involved in medical assistance going to be improved by carving out these services? A few years ago, the state embarked on a preferred incontinence program because of the potential cost savings of using a single administrator. There were modest savings, but it also resulted in enrollees not getting the products they needed. It ended up many enrollees getting bed sores, infections, and resulting in declining health. The state went back to using a multiple vendor a few years later. We should focus on enrollee care and member experience first and foremost, and we urge the committee to consider this when bill language is presented. Thank you.
Thank you, Mr. Andreessen, for your testimony this morning. Are there any questions for Mr. Andreessen and the Council of Health Plans? All right, seeing none, the committee thanks you for your testimony today and wishes you well in your further endeavors this session. Next up, we would like to welcome Lori Schleitenhofer with the Minnesota Organization on Habitation and Rehabilitation. Welcome to the committee. If you could please re-clarify your name for my pronunciation purposes and present your testimony.
Yes. Thank you, Mr. Chair and members of the committee for the opportunity to be here today and speak with you. My name is Lori Schlutenhofer. I am co-president and CEO of Services for Opportunity Partners, which is an organization providing a broad spectrum of residential employment and day services for Minnesotans with disabilities. I also serve on the board of directors for the Minnesota Organization for Habilitation and Rehabilitation, otherwise known as MORE. And I apologize for sending the committee and you, Mr. Chair, such a jumbled word salad of consonants this morning. I am here today to speak on behalf of over 100 nonprofit providers of employment and day services for people with disabilities in the state of Minnesota. And I thank you for this opportunity to share our views on the recently released governor's budget proposal. When the governor's proposal was released last week, it was extremely disappointing to see the proposed state funding reductions for waiver-funded disability services, especially around employment and day support services. There are two proposals specifically that I'd like to draw your attention to. The first is found on the bottom of page 133 in the governor's budget proposal for the human services section. And what that suggests is that we reduce a component of the rate setting methodology called the absence and utilization factor. And what this is really most simply is a factor in the formula that accounts for the fact that a provider needs to have staff on duty, needs to have vehicles, needs to have services and supports available. And some of the people we serve, because of medical complications, psychiatric complications, are not able to attend every day. But we need to be ready to serve them. The proposal from the governor's office suggests that we move that absence factor downward from the current 9.4% to 3.9%. I can tell you, looking at my organization, Opportunity Partners experience in 2024, we see an absence rate of 11%. And bringing this factor down to 3.9 would really equate from our calculations into over a 5% reduction in the rates paid to provide those services. The second proposal, which is found on page 136 of the DH section, proposes to cap scheduled adjustments to the inflationary adjustments to the disability waiver rate system. As my colleagues at ARM shared earlier, this will have just a devastating impact. We have been at the legislature year after year talking about the discrepancies because the automated rate adjustments that are built into the rate setting formula are based on backdated data. We have been trying to play catch up for a number of years. And as Ms. Grafstrom had shared before, day providers, residential providers are continually looking at how we can invest and raise wages and come to a level of a livable wage for the staff who provide the valuable services we provide. Capping those increases when there is already such a discrepancy between what we are able to pay our staff persons and what people in the private sector are able to earn will just be devastating as we move forward. The bottom line is that state reimbursements for our services, as I mentioned, go primarily to wages and fighting that battle of bringing our staff's wages up to a livable level. And these funding reductions will only make the situation worse as we go forward. And it'll make it harder for people across Minnesota, many of whom are already stuck at home waiting for services because we're unable to hire the staff to provide them. This will have a dramatically negative impact on our Minnesotans. We know that our state policymakers have some very difficult decisions to make. in order to fund the budget and agree on spending in an environment of limited resources and increasing costs. We only hope that the governor and the legislature will see our community members as a priority as we do this work together and help us to continue to try and offer competitive wages for the people who make it possible for Minnesotans with disabilities to live full and meaningful lives. I thank you for the time, and I'm open to questions.
All right, thank you, Ms. Schlutenhofer, for your testimony this morning. Are there questions for Ms. Schlutenhofer? Seeing none, the
Okay.
committee thanks you for your testimony and wishes you
right.
well in your endeavors this session.
Thank you, Mr. Chair.
Thank you. Next, we have Brian Zerbis with the Minnesota Association of Resources for Recovery and Chemical Health. Welcome to the committee. If you could please state your name and present your testimony when you're ready.
Great, thank you, Mr. Chair, committee members. As mentioned, my name is Brian Zerbis. I'm the Executive Director of March. Much easier than rattling off all the words there. We provided a letter of testimony. I wanted to give kind of a high-level overview of some of the points that we see in the governor's budget. One positive we do see in the budget is regarding audio-only telehealth extension. We do see that as a positive part of the governor's budget, and we're pleased to see that. However, the provider community is deeply concerned and disappointed that rates for mental health and SUD were not included in the governor's budget, as recommended by a recent rate study that was submitted to this body or the legislature this past January. For over a decade, providers have gone through a number of different rate studies looking at the cost of delivering care, and this most recent version was conducted by Burns and Associates. There was good provider input. The rates that they developed were based on the cost of delivering what's called ASAM level of care. ASAM is the American Society of Addiction Medicine, which is a national standard of care that Minnesota has been moving towards. And so the rates they developed were looked at the cost of staff, no-show rates, admin percentages, et cetera. And the rates that they brought forth for substance disorder rates, there were 9 distinct rates. 8 of those 9 rates were identified as needing an increase in the rate. And when you average out the needed increase across those 9 codes, it results in a 68% increase needed to provide services at the cost of delivering that care. One of those rates in particular is it's level 3.1. It's low intense residential. The current reimbursement is about $79 per day. That rate is identified as needing a 171% increase. So you think of trying to run a business, serving people, and it is impossible to think of how would you create a business model where you're going to get reimbursed 171% below the cost of delivering that care or that service. So, certainly ignoring these recommendations perpetuates strain and stress on programs, on their staff and providers. We urge the legislators and this body to prioritize funding to begin implementing the recommendations without delay. Within the budget, there was a projected surplus of $355 million by the end of fiscal year 20 and 29 that may present an opportunity to invest in the sustainability of mental health and SUD programs. Certainly these services are a critical lifeline for individuals, family members, people in our communities. Investments in mental health and SUD certainly has a major return on investment. There is a number of studies that identify for every dollar you spend in treatment results in less dollars spent in public service dollars to crime, also averted healthcare costs. Certainly, the state is also moving towards the 1115 reentry waiver, which will provide opportunities for people leaving incarcerated settings. So we want to have a vibrant provider community that's able to provide, have good staff, have good rates. We know that treatment saves lives, it strengthens families and communities. By addressing these disparities and supporting dedicated providers on the front lines of Minnesota, we can reaffirm commitment to the health and well-being of all of our citizens. We ask for your leadership and action to ensure that these life-saving programs are not just sustained, but strengthened for the future. Thank you.
All right, thank you, Mr. Zerbis, for your testimony today. Are there questions for Mr. Zerbis? Very good. Seeing none, the committee thanks you for your testimony and wishes you well in your endeavors this session. Finally, today, we have Danny Ackard from the Minnesota Hospital Association. Welcome to the committee. If you could please introduce yourself for the record, and when you're ready, present your testimony.
Fantastic. Good morning, everyone. My name is Danny Ackert with the Minnesota Hospital Association. I serve as the Director of State Government Relations. Although there are many provisions in the Human Services budget that impact Minnesota's hospitals and health systems, I will be speaking to two proposals today and have submitted written testimony with more detail for your reference. The written testimony was not included in the pack. I do have copies. They are color. I'm not sure, I didn't see a page, but I can help pass them out if you'd like. We have 10 minutes, or I don't know.
If that's how you choose to use your time, Mr.
Yes.
Ackard, that's
I would love to start by echoing what ARM and the Long-Term Care Imperative has said regarding the challenges that nursing homes, long-term care facilities are facing right now. One of the direct connections that hospitals and health systems have to them is our discharge delay issue and where people can get the right level of care at the appropriate time when they need it, and often that is occurring at very slow and delayed rates, which is directly impacted by the challenges that they face. And we're trying to serve patients collectively as best we can, and there's some real challenges. The first item in the budget I would love to discuss is that our strong opposition to the Department of Human Services' longstanding pharmacy carve-out proposal and its unnecessary negative impacts to safety net providers and the federal 340B drug pricing program, or 340B. Although we support improvements to the operations of pharmacy benefit managers, or PBMs, used by Minnesota's managed care organizations and fully supporting community and independent pharmacies, this budget proposal would collectively result in the loss of roughly $86 million annually in outpatient savings from the 340B program. Savings that are used today by safety net providers to help provide strong access to healthcare and community support services across the state. While this proposal does document an increase to the state's ability to generate Medicaid rebate revenue, it is at a greater expense of safety net providers. I just mentioned $86 million. That's from the Department of Health's recent report on the 340B program. If the state were to take all of that in Medicaid rebates, the federal share is actually withheld, so about 70% of that $86 million would just stay in Washington, D.C. and not come to Minnesota and not go directly to patient care services. Further, the proposal offers no clarity or transparency on how DHS would better serve patient care needs today, especially, and it's been mentioned just recently, when medical assistance reimbursement rates remain chronically below cost for almost all services and cannot adequately support patient care. This is one of the main reasons why 340B is so crucial in Minnesota, is because the chronically low medical assistance reimbursement rates. Lastly, the negative impacts of this proposal are not necessary. Kentucky and Ohio have implemented single PBM models in their Medicaid programs that remain in managed care, control and eliminate negative PBM practices, appropriately reimburse independent and community pharmacists and their dispensing fees, optimizes the 340B benefits, and does not negatively harm patient access to care. As such, we urge the legislature to pursue the models that states like Kentucky and Ohio have implemented. Second, we also support the governor's proposal to extend access to audio-only telehealth and its unique ability to increase access to equitable care for patients with behavioral health and chronic care conditions and individuals with limited broadband access. Many hospitals and health systems in both rural and urban areas rely on audio-only telehealth services to provide ongoing care coordination services that prevent emergency room visits, prevent other additional acute care visits. Better for the patient, better for the care system, better for everyone. MHA encourages the legislature to support the governor's proposal to preserve patient access to telehealth services across the entire state by extending patient access to audio-only telehealth services. With that, Mr. Chair and members, thank you, and I stand for any questions.
Thank you, Mr. Ackard, for your testimony today. Are there any questions for Mr. Ackard and the Hospital Association? Representative Gander.
Thank you, Mr. Chair. Thank you for your testimony. Thank you for advocating for hospitals. I know in my district up in northwestern Minnesota, the rural hospitals up there are just barely hanging on. Whatever public impression may be out there that somehow when you see your EOB that comes with your whatever procedure you had and you think, oh boy, these folks are just swimming in cash, couldn't be further from the truth. When you consider all the reductions that take place, all the discounts, all the different things that happen, and the high cost of providing the care, these medical facilities are just barely hanging on. And so I'm going to support not making such kinds of cuts that would adversely affect rural health care in Minnesota. What are your thoughts on that, if you could respond? Thanks, Mr. Chair.
Mr. Eckert.
Thank you, Mr. Chair. Representative Gander, I agree 100%. And I would stress that the ecosystem of healthcare across the state is under incredible stress. And whatever that stress level, if you could register it as a number, I would add 10% to that when you focus in on the rural areas and the challenges that are faced not only on workforce, reimbursement, but also demographics, and the actual physical distance between service locations. Transportation is a challenge. I know Chair Backer knows this firsthand. We talked about it yesterday. NEMT is incredibly challenged right now. EMS is incredibly challenged. So the entire ecosystem, and obviously I represent the hospitals. We are one of the backbones of that ecosystem, and the stress that we're feeling is incredible. And so that's why we're urging the legislature or the Department of Human Services to reconsider their proposal, and also audio telehealth, just going to plug that again. It has been able to really make connections, especially when workforce is challenged and you have one provider for a growing number of people. Audio only and telehealth services allows for capacity to remain at sustainable levels that serves patients when they need care and offers more connections to additional services they may need.
Representative Gander. Thank you. All right, any further questions for Mr. Eckert? All right, Mr. Eckert, the committee thanks you for your testimony today and wishes you well in your endeavors this session. That concludes the list of people who had requested time for the hearing today. I can open it up if there's anyone else who wasn't able to make it on the list but would wish to offer testimony today. Seeing no one standing up, we'll close the option for public testimony, and that concludes our agenda for today. Just one editorial piece before we conclude is that I understand outside of this room that there's been concerns about anyone who's giving testimony today that legitimizes the current structure in the House, and I just want to note for the record, if there is a record, that I don't really see it that way. The people that presented today did not endorse the format that we're using. They have to deal with what the decisions that they make with that. The elephant in the room, of course, is that there's a fight at the leadership level in both of our caucuses in the House. But the way I see it is that everyone here has a boss to deal with, and for the people who presented today, their bosses don't care about that fight between the two caucus leaderships. And so that's how I look at it. That's how I'll be continuing throughout the rest of the session, looking at this, and thank everyone for their time today and reflecting on the governor's proposals. I'm sure we'll have more discussions on that as we move forward. And with that, the committee stands adjourned until Tuesday, January 28th, 8:15. Thank you.